Let's talk about mid-urethral sling for stress urinary incontinence in women, what you need to know before this minimally invasive procedure. Let's first talk about what stress urinary incontinence is. Stress urinary incontinence is the involuntary loss of urine during physical activity, which can include when patients cough, laugh, lift, sneeze, or exercise. Incontinence happens when the muscles that support the urethra, which is the tube that carries urine out of the body, are weakened and damaged. This can happen as a result of childbirth, trauma, hormone changes, and a variety of other reasons. But it's important to know you don't have to live like this. Stress urinary incontinence can be treated with both surgery or non-surgical interventions. If you suffer from stress urinary incontinence, please know you're not alone. Stress urinary incontinence affects approximately 18 million adults in the United States, and 85% of these patients are women. Sufferers of incontinence typically wait 4 to 6 years before seeing a doctor or healthcare provider about their problem. As many as 1 in 3 women will experience a pelvic floor disorder such as stress urinary incontinence during their lifetime. In terms of treatment options, it's important to keep your weight down and keep active. Physical therapy, including pelvic floor muscle training with Kegel exercises and biofeedback, can be effective. Vaginal pessaries can be used. Patients will wear pads or diapers, but there are also surgical options, including traditional mesh slings, single incision mini slings, and bulking agents. The mid-urethral sling system is specifically designed to provide a hammock of support under the urethra to prevent it from dropping down during physical activity. This support mimics the normal anatomy that will then prevent or reduce urinary leakage. Let's talk about the different types of slings available. So there's a sling through a single incision, a prepubic sling, transobturator, or retropubic sling placement. The indications for surgery include stress incontinence that does not get better with pelvic floor therapy, when the incontinence is so bad that it impairs one's activities, and or incontinence that requires the use of daily pads or diapers. So what are the risks of surgery? Patients can experience pain, infection, bleeding from the vagina, or even a hematoma formation, which is when blood can pool under the skin, urinary retention, which is the inability to urinate, or new onset urinary urgency. Patients can experience persistent leakage of urine. Patients may have mesh erosion, which is when the presence of mesh material within the tissue surrounding the vagina appears. Patients might have damage to the urinary tract or fistula formation, which is when a passage develops between the organs that are usually repaired by surgery. Patients may experience nerve damage or pain during intercourse. Surgery for stress urinary incontinence is minimally invasive and is estimated to take only about 30 to 45 minutes. Your doctor will help determine the type of anesthesia you will need during the procedure. A small incision will be made in the vaginal area, and the synthetic mesh will be placed to create a sling of support under the urethra. After the mesh is effectively positioned, the surgeon will close the incision and a small bandage will be applied. Because the procedure will be done under anesthesia, you will need to fast starting the night before surgery. Certain medicines like blood thinners may need to be held for several days before the surgery. A preoperative exam, including blood work and an EKG, is usually required and will need to be done by your primary care physician. You will need a ride home from the procedure, and a responsible adult should be with you the first night after the surgery. Your doctor will go over with you if you require anesthesia or if this could be done under local. The surgery is usually performed in your urologist's office or the ambulatory surgery center. These are usually conveniently located and are specifically designed for outpatient surgeries. Sometimes patients need their surgery done in a hospital because of underlying medical conditions. Before you're discharged from the recovery room, you may be given a prescription for an antibiotic or pain medication to help with your discomfort. You may have temporary burning with urination. You will be instructed on how to care for your incision, and at the discretion of your physician, most patients will resume moderate exercise within 2 to 4 weeks. but it's important to avoid strenuous activity for up to 6 weeks. Your doctor will review your specific restrictions. Please call your doctor if you experience fever over 101.5, chills, if you notice any redness or drainage from the wound, if you're unable or have difficulty urinating, if you have nausea or vomiting, or pain that is not well controlled. The pre-authorization process is very important, and we will communicate with your insurance company to determine your coverage and if any copayments or deductibles are owed. We'll provide you with an estimate of any charges that you may incur, and all of these charges are due prior to the procedure. Payment plans are available. A surgical scheduler will give you a date. You may need medical clearance with your primary care physician or internist, which will include a history and physical exam. Blood work, an EKG, and chest x-ray may also be needed. You will get a letter with all of this information about where and when to report. If you're receiving anesthesia, you should not eat or drink after midnight. One of our nurses will call you and discuss your medications and what you can take the morning before your surgery. If you're taking a blood thinner such as aspirin, Plavix, Coumadin, Xarelto, or Eliquis, please let your surgeon know, as special precautions may need to be taken. Remember, never stop these medicines without a discussion with your primary care physician first. On the day of surgery, please arrive early, at least 1 hour before your scheduled time. And if you're receiving anesthesia, make sure that you have a ride home. That person must come in and stay in the waiting room during the procedure. We really hope that your procedure goes well and that you have a very speedy recovery. We sincerely appreciate your feedback regarding how your procedure went, as we're always trying to improve the care that we provide to our patients. If you have any questions at any time, please contact your doctor. Thank you.